and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, a lifestyle and much more. Well, viewers, no matter what your skin type is, a daily skincare routine can help you maintain overall skin health and improve specific concerns like acne, scarring and dark spots. Today we are going to discuss about various skin-related problems, and to discuss on this, we have with us in studio Dr. Sharadi Shreemoyee, clinical cosmetologist and aesthetic physician. So not to waste any more time, I'll straight away move to her and talk more on the topic which we have taken today. Thank you so much, Dr. Sharadi, for coming to Good Life, the health show. And indeed, I'm sure the women will be very happy today, and the ladies would be very happy today. The topic which we have taken is skincare. And let's start up with the various skincare problems which is being faced by not only women but men as well.
Okay. So Pooja, basically the very basic problems that we face, the commonest ones that I would like to talk about is acne.
Okay.
Pimples, as we commonly call it. So pimple is something we face on a day-to-day basis, be it men, be it women. They may be of any age, any age group, be it teenagers, even in adults.
Right.
Nowadays we see a lot of acne. So the most important thing when acne starts, when people are young, teenagers, many people say, and many doctors also say, that this is the age, hormones are there, it will go off on its own. It is true. Acne goes away on its own after a certain age, because hormones have a very important part to play in it. But the question is, should we treat acne at that level when it starts?
Okay.
Because most people think since it will go away, there is no need to treat it. Okay, but that is not the truth. Acne needs to be treated at every stage, because if we don't treat acne, it leads to lifelong scars.
It might lead to some worse kind of thing as well.
Worse kind of things, and it leads to lifelong scars. If you don't treat it at the beginning of the lesions, at the beginning of the acne when it starts, it will always lead to a scarred face, which you have to live with all your life.
Right.
So always go to a doctor when acne starts, whatever age you are. Ask your parents to take you, or if you're an adult, if it has started at that level, always start taking treatment. Don't just procrastinate. Don't just think that okay, it will be over.
So
on
acne
its
is
own.
one kind of like a basic common problem, basic skin problem which everybody face. In we can't talk about a particular age group.
No,
it's all about the age group and whatever. But proper examination is very important, and proper treatment is actually very important. Proper things has to be done, and related to your diet or related to everything, whatever is possible. So let's talk about some other problems which is related to skin and which is being faced by the common masses.
Another very important problem is the pigmentation that we see on a regular basis. Especially in this part of the country, northeastern people, we have a tendency of pigmentation. As you can see, freckles, like we call it, that small dots that we see on people's face, and there is a mask of pigmentation that we see, that is known as melasma.
Okay.
All right. That is in some women it is seen after pregnancy, and otherwise also, since we live at a higher altitude in the hilly areas, we are more exposed to the sun, because of which we have this tendency of, and the genetic and environmental factors are almost there. So pigmentation again is a very big problem.
That is another problem. So I'm sure, but the phone lines are open, viewer, if you have any queries regarding the topic which we are discussing right now, various skin type of problems, and related to anything like Dr. Shreemoyee is here, so you can call up and ask your questions, and she is ready to give you the answers and clear your doubts as well. Alright, doctor, coming back to you again, we are starting we started with acne, we knew about it, and we started with pigmentation as well. So there are other various related problems, various skin related problems. So how do you build up your skin care routine? And that is a very important thing, skin care routine for everybody, not only for women but also for men as well.
Yeah, well, skincare routine differs from age to age. It is the routine that will be good for a 20-year-old is not going to be good for a 30-year-old, and it's not going to be good for a 40-year-old.
Right.
So you have to tailor your skincare routine according to your age group. So basically, when you're in your early 20s or maybe even late teenage, skincare routine should start.
Okay.
It's not that, when we are blessed with a good skin, we tend to ignore it, or we tend to take it for granted. But we should always start taking care of it. First and the most primary thing when you're young is to start the habit of applying a sunscreen. I cannot focus this more. I keep telling this in my every interview.
Okay.
You have to keep applying sunscreen because sunscreen, when you start at the very early age, it goes a long way. Because what sun does, does a lot of damage to our skin. Not only tanning. People think if I don't apply sunscreen, I'm going to get tan. I'm going to become darker.
Right.
That is only one part of it.
Okay, that is only part. That is the common thing. Everybody knows about it. Sunscreen means tanning.
Yes.
If you need to go out of sun, go out to the sun, you have to use sunscreen. But it has to have another inputs as well.
Yes. Second one is the pigmentation that we face. If we have a tendency of pigmentation, not apply sunscreen will only increase the risk of it.
Okay.
Okay. Then there is a thing that it also helps in anti-aging. Sun causes aging.
Okay.
Sun causes wrinkles. So when we don't apply sunscreen, we start aging early. We start aging early. So sunscreen is the most important thing that you have to start. Next is there are certain basic things that you can incorporate in your skincare regimen. One is the vitamin C serum. Once at night or something, you can start at a very early age. There are no harm. Vitamin C, vitamin E serum combinations you can apply in your skincare regime. Then depending on your skin type, you can choose a moisturizing cream for your skin, night cream or anything. That depends on your skin type. Not one cream doesn't suit everyone. So if you have a dry skin, combination skin, oily skin, depending on that, you have to choose one.
Okay.
Okay. You have to check for the tag when you go to buy a product that the word non-comedogenic. There is something which doesn't cause acne.
Okay.
Okay. Then use a good, if you have a dry skin, the type of cleanser that you're supposed to use, that also depends.
Okay.
If you have a dry skin, you use a cleanser kind of a thing, like a lotion based cleanser. If you have oily skin or acne prone skin, you can use a tea tree oil based cleanser.
So there are a lot of things and a lot of products also available, but it's always correct, which is correct for their skin type. So how to know a skin type? Like, is it always necessary to go to a cosmetologist to know your skin type? Because at home, sitting at home, you won't be able to know what your skin type is. You might make out that my skin is oily or my skin has become a lot of, it's dry. So, but at least you should at least once in a while you should visit a cosmetologist. You can get a proper information about it, and then things will be more clear, isn't it? So you face those kind of problems when anyone come to you and talk about their skin type, what kind of skin type I have?
Yes, people often come to us and asking about the skin type, because most of them, they think they're a certain skin type, but then they turn out to be something else.
Okay.
So because there is no one proper thing that fits all, right? So when they come to us, I do a proper checkup. It is very important that they get their skin type checked, because once they start making small changes depending on the skin type they have on their skin daily routine, it goes a long way. Then they can keep their skin healthy for a long time.
It suits me, suits me, so I can use that product also for a long time.
Yes, and it is always advised to go for medicated products. There are so many options out there. So, but if we, something which looks good, something which suits on you may not suit on me. So it is always better to go for tailor-made medicated products, which will be best for one skin type.
All right. So there are a lot of things like it's related to your skin, and it's always recommended that you should always visit a cosmetologist for a better understanding that what skin type you have and what are the products which will suit you in a long run. So we will talk more on the skin related issues. Anti-aging is one of the common issues, and which we have seen that it's talking about our mothers and talking about the elderly people. They don't take a lot of care about them. So for them, like if we talk about the anti-aging problem and talking about the younger, they are now very much conscious about their skin, not only women but also men. But talking about the elderly people, and also about if you don't take care of your good health or don't take care of your skin, then the skin will have its own age marks, isn't it?
Yes.
So anti-aging, so what do you have to say on that? Like anti-aging, is it only related to the elderly people? or we are talking about a certain section of people?
No, actually it's a misconception. Usually when people come to us seeking anti-aging treatments, they are already at a very advanced stage. Okay, but I cannot stress this much enough. You have to start taking care of your skin in an anti-aging way also, just after you have turned 30, because aging process starts after we turn 30 already. So small things, I'm not asking for big procedures or something, but then when you start doing small procedures, like even a chemical peel is considered to be having anti-aging effects.
Right.
All right. But
because whenever they see any product of anti-aging, so they think that this is not meant for us. This is only meant for the elderly people. So this is the misconception. Actually.
When you start taking care from 30 onwards, then you will stay younger, or look fresher, and your skin getting better taken care of once you get old.
Okay.
That's how it is.
That's how it is.
As far as anti-aging procedures are concerned, nowadays we have made so much advancement in various procedures. Botox and all, everyone is already well aware about by today. So then we have fillers. Then we also do certain lifting procedures like non-surgical. There are many people who are very afraid of needles. They don't want to go under the knife.
They don't like those piercing
and needles. They don't want to go under the knife. So for them also we have many advanced procedures nowadays, like radio frequency, high intensity focus ultrasounds. These are the machines which help in tightening and lifting the skin without any injections, without any piercing. So as medical science is growing, we are making advances every day.
Advances and technologies have also advanced so much that there are a lot of things, like if you go to a clinic then only things will be more clear. And if talking about any person who is totally unknown about these things, and the first time he has heard about certain terms or aesthetic or these kind of terms, which I have not that much of knowledge, a basic knowledge I have, but if a certain person come to your clinic, so this is a very important thing for you to make them understand. So at that time the challenge starts. So what is the first thing whenever a person comes to you, that what kind of skin type I have, and what is the first thing I should go for it? So what kind of challenge do you start up?
Clinical cosmetology or aesthetic medicine, as we like to say it, is a comparatively new branch in northeast of India. So I have been doing interviews, I have been talking to people, trying to raise an awareness for a few years now. And thank to God, we have been able to raise a certain level of awareness.
So people are getting aware about it.
People are getting aware. People are coming to us for these procedures directly now. When I started, it was a time where maybe not even there were, but not even 1% of people knew what it was.
All right, doctor, we'll come to this discussion. We have to slip into a short break, but again we will come and discuss on this. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back. You're still watching A Good Life, the health show with me, Pooja, and we are having a fruitful discussion on how to take care of your skin, various skin-related problems. All right, doctor, coming back to you again. Earlier to the break, we were talking about any person visiting your clinic, or what is the first thing, or the confusions. Are there lots of confusions in their mind? Because internet is one kind of medium which creates a lot of confusion, I feel like, because when they search a lot, you get a lot of confusion in your mind, and then things will be more not clear. So at that time, a cosmetologist is the person who will make your things clear, isn't it?
Yes.
So what happens when anyone comes to you with any kind of problem?
Pooja, like I said, this is a newer branch out here, so we have to create a lot of awareness and we are doing, and we are getting a lot of awareness of late. But still, we get on our clinic people who are, very apprehensive about a lot of things because of the misconceptions created in the internet, or because they've heard something from somewhere. So it is, we have to take a lot of time, talking to those people, making them understand what we really do, how it is not different from any other branch of medicine, how it is not harmful, like it is like any other, it is just a science that we are doing, like a medical science.
Because when they see a lot of equipment and machines, they might be very apprehensive. And what is this all about?
Yes, it is just a controlled science like any other medical medical branch of medicine. And we do as per guidelines, we do all the procedures.
Okay.
What is important for people to understand is that they should go to a trained professional, not just do the procedure anywhere, and talk to your doctor, get your confidence, let your doctor give you the confidence that this is safe, this procedure, and totally understand and go for it, because there is nothing wrong in going for aesthetic procedures, be it chemical peeling, be it laser or Botox fillers or any other procedure, as long as you're getting it done with a trained professional.
Absolutely there, and not only the ladies but also we are talking about men, because nowadays about their skin as well. So we are having a healthy discussion right now, and doctor, there are a lot of problems when we talk about seasons, a lot of seasons, and so seasonal related problems regarding your skin. So let's talk about this dry season which is appearing and it's already there. So a lot of skin related problems comes up.
Yes.
So at that moment of time, how diet is important, how your physical activity, your lifestyle is important. So everything is related actually.
Yes.
So what do you have to comment on that?
Of course, diet is very important. In this season, especially in winters, we have a tendency that we don't drink much water on our water intake. We tend to get
Fluid intake
lazy.
is very less.
So it is very important to drink a lot of water. Fruits, a lot of citrus fruits is very important. And what is advised nowadays is that you take a glutathione and vitamin C tablets are available nowadays.
Okay.
So you can take those, and they come in effervescent tablets, which you can put in water. It becomes like a juice, and then you can drink it. That helps in a lot of hydration. That gives an internal glow, internal hydration.
Is it?
And even helps in prevention from sun tanning.
So
and
how
stuff
safe
like
are those?
It's absolutely safe.
Very safe.
Glutathione is something which is considered to be given even for liver toxicity patients.
Okay.
Even those patients who are hepatic liver problem patients, it is given into even to those. So it is considered to be very safe.
So when you suggest them or when you recommend them to have those kind of like medicines or whatever we can call about, so is it like recommended to any kind of people, or is it like recommended
unless it is
if you don't have any other health issues?
Yes, of course I'll take a history before giving it to them.
Of course.
If there is any kidney failure or those kind of things, of course I will not give them, but apart from that, it is quite safe.
Okay, and other than that, dietary is one of the physical activities, some exercises or yoga is very much in these days. So these are also very important for your healthy skin and also healthy mind as well.
Yes, of
So
course.
on that note, like what do you suggest whenever any person comes to you? The treatment is side by side, whatever the things are going on, but you have to have a healthy lifestyle.
Yes,
isn't
of course, of course. When I talked about acne, see, as I said, acne is it is a lifestyle disorder.
Right.
Right. One can be because of your diet, because of your hormonal issues and all. None of these can be only treated with medicine.
Right.
Medicine is a part of it, but at the same time, you have to have a healthy lifestyle. You have to control your diet. You have to do exercise to balance your hormones, to balance your other, cholesterol and everything, so as to completely, control the acne. And medicine is 50% of it. So medicine is to reduce what you have. But the causative factors are your diet, your lack of exercise, your hormones.
That has to
be treated, taken care of simultaneously. Yeah.
So one should not ignore those things, and physical activities where because lifestyle has become so busy these days. So people just run out of and they go for their work and they don't think about proper breakfast or proper lunch. But that has to be avoided, or things can be taken up in your small meals, and small meals in
healthy meals is more important. It's not about if you just what happened in this busy lifestyle, people just grab and eat anything as in when they go.
Right.
So it is very important that they plan their diet, even if in small quantities, they try to take as much as healthy food as possible.
So healthy food is very important for everyone. So now talking about the natural remedy, there are a lot of people, they are not been so much into using these medicines or can use this treatment as well. So they use a lot of natural remedies, or the nuska we talk about, our grandmoms or any elderly people have given us. So how important is to know the procedure properly? If you use something mixed with something and it becomes, and it gives you another reaction as well. So the natural remedy is helpful but effective, but also in a proper way, isn't it?
Exactly. Suppose we face many patients in our clinic, who come with all black or red cheek and all, and then when I ask them what happened, I applied this thing from my kitchen. They apply something or the other Some people, I have seen patients who have applied onion on their face.
Onion on their face, lemon, if it's a citric acid, if it doesn't suit you,
it will burn.
It will burn.
Citric acid. See, when we talk about things like chemical peel, people are like, oh doctor, there is chemical in it. But no, even citric acid, then lemon, that itself is a chemical. So the chemical that we use is also natural, nothing artificial that we use. Okay, but then what we do is in a controlled manner. Medically controlled manner.
We know that which one will
what is the concentration is to be given, how much to be given, you know. But when you're applying it from your kitchen, you're applying a piece of onion, you're applying a piece of lemon on your cheeks. You cannot control the amount of damage it is going to do. So you don't know whether it's actually peeling off your skin or burning or harming your skin. So I would rather advise to take a little bit of, occasionally taking a few things, doing a few things like applying curd and all is okay, but don't never go too aggressive on natural home remedies without proper care and proper, you know. It is better to talk to a cosmetologist and discuss and understand.
Yeah, it's always to have a safe hand. It's always to have a talk with your near and dear ones also. You can just get some suggestions and then use it, because like we have heard about a lot of like accidents. These are the natural accidents which happen. You use it and something happens, and then you run to a cosmetologist. But it's a challenge then.
Yes, the sad part is when they come at that level and they expect overnight for us to, you know, correct them, but that becomes very difficult because once whatever has happened, it's a form of scar. It's a burn or scar or whatever it is. So it is very difficult to correct it at that level. So rather than doing that, it is better to come in the first place when the damage was less. The chances of improvement is much better.
Okay, and we have also seen that shifting of like clinics, shifting of clinics have been seen regularly with all kind of like patients, all kind of people. So what do you think, if they have started up with the procedure, do they have the right to change, but do they should wait, or do they should think that this medicine is not suiting them or this treatment is not suiting them, that they should have a talk with the cosmetologist? What is up?
So the thing is that of course people can try someone else if they want to, right? But Pooja, the thing is that skincare is a constant work.
Absolutely.
You cannot just expect miracles overnight. So skincare is like it's a dedication, it's a commitment you have to make to yourself. So once you start a regime, it takes time.
Right.
So it is always important for us also to keep a better communication. If someone is coming from somewhere, some other doctor, I always say, okay, you should have given her more time.
Okay.
Okay, and if you are going to be with me, you have to be patient. Because I will not be able to deliver you results overnight, because it is not one over-the-counter cream which will do you more harm than good. It is a constant commitment. So I just give one example. You have washed your face today. Do you expect your face to be clean forever? No, right? You have to keep washing it daily. It's a constant thing you have to do.
It's a constant thing. It's a regular procedure.
You have eaten food today. Do you expect to remain healthy and
like your tummy should be full for the entire... Right.
That's not like that. Similar goes for
its time, it will take its time. So things has to give in its own time. On last note, like we are really short of time, so on last note, what would you like to tell the viewers who are, I'm sure they are very excited at this point in time, we are watching our show, so what would you like to tell them?
One thing I wanted to bring into focus, Pooja, today is that most of the people, they tend to not come to a doctor first and then go to a pharmacy for the simplest of the things. Say they have an acne, they have a pigmentation, they go to the pharmacy and they take over-the-counter medication. I would like to say that most of these medications contain steroids. So initially when they apply it, they get instant relief, but believe me, these steroids cause a lot more damage to your skin than actual good. So kindly, I would like to advise not to go for these over-the-counter medications and directly come to a doctor for advice.
All right, thank you so much, Sharadi, for coming to our show, and I'm sure the viewers who have watched our show must be benefited. And with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.
Thank you.